Welcome to Field Notes, Insights from New to Public Health Alumni. New to Public Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, New to Public Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Jasmine Thompson Blum, All Our Kids Network Coordinator with the Adams County Health Department in Illinois. Jasmine graduated from the New to Public Health Residency Program in September 2024. Thank you so much for being with us today, Jasmine. Tell us more about your background and transition into public health.
Hi, Juliana. Thank you so much for having me. Prior to working in public health, I worked for a domestic violence agency for 5 years. I was a legal advocate for 3 years, where I helped survivors obtain orders of protection against their abusers and supported them through the court process. After that, I was a counselor for children and adults. I counseled children as young as 3 years old, and I learned about all our kids' early childhood networks through my counseling position. I was a part of our local AOK network since I provided services for children under 5 years old. So when the AOK coordinator position became available, I jumped at the opportunity to apply. My work in domestic violence was very fulfilling, but I knew I wanted to transition out of direct service work, and AOK sounded like the perfect opportunity to still help those in my community while prioritizing my own mental health.
Wow, you have done a lot of impactful work in your career so far. It's really inspiring to hear how you advocated for and helped so many people in really tough situations. And it sounds like that work has really shaped your approach to supporting your community through your current role with All Our Kids or AOK. Would you expand upon your current role and tell us a little bit more about AOK?
Sure. AOK is unique in that it is a community collaboration that focuses on improving the early childhood education and care system for families. We promote healthy pregnancies and the positive growth and development of young children and their parents and caregivers. We work with various system actors, including daycare providers, parents, social workers, healthcare workers, librarians, and so on, to create and implement a shared agenda. Right now, we are wrapping up phase two of our community assessment, planning, and action process. In phase one, we assessed child and family outcomes to narrow down a targeted problem. Our targeted problem is based on evidence that suggests that not all young children in Adams County are developing positively. More specifically, we found that not all young children are meeting benchmarks for kindergarten readiness measures for language and literacy development. Many mothers are using harmful substances during pregnancy, and more families are experiencing food insecurity. In phase two of the assessment, we talked with AOK community partners in depth about current system issues and strengths related to our targeted problem. We had focused conversations organized in 4 different threads or components titled Centering Families, System Actors, Services and Supports, and Information and Referral. Now we're in the process of sorting and summarizing all of the data we collected in order to design tangible strategies to address our targeted problem.
All right. Wow. That is very incredible, detailed work. And it's clear AOK in your role in the organization is really making a difference in Adams County for those kiddos. Um, I'm curious, how did your experience in the New to Public Health Residency Program contribute to some of that work that you're doing now?
It was wonderful. The New to Public Health residency program provided a great foundation for someone like me, someone who is new to the field of public health. Prior to New to Public Health, my only knowledge of public health included COVID-19 and vaccines. I had no idea of the history of the field and that there were so many areas such as environmental health, communicable diseases, emergency preparedness, opioid education, and injury prevention. Specifically, the evidence-based practice project residents completed as our final project was helpful to my work in AOK. For my project, I proposed a support group for mothers to encourage smoking cessation during pregnancy. And it gave me the opportunity to visualize a solution to one of the areas of our targeted problem and how it could be realistically carried out.
Oh, I'm so glad to hear that New to Public Health helped expand your view into that breadth of public health services. And your project was outstanding. I'm glad New to Public Health was able to be that catalyst for you to address a realistic need with a tangible solution for the pregnant people you're working with. I just love so much seeing projects come to life like you shared with us today. So, Jasmine, thank you so much for sharing more about your background into public health and the current work that you do at All Our Kids and how New to Public Health support you while you were new in your role. You are certainly making a significant impact in your community. So, thank you again for being with us today, Jasmine, and thank you for your service in Adams County.
Thank you so much.
Thank you for listening to Field Notes, Insights from New to Public Health Alumni. For more information, visit new2publichealth.wisc.edu.